And the thing is that, we didn't have as much education about it, as, not our moms and our grandmothers, they didn't have as much education either. So it's not something that your mom was like, okay, listen,
Here's
this
what
is
you
what's
do.
going to happen in menopause, right? Or
Yeah.
this is how I felt, or this is what happened to me. Nowadays, because of social media, because of, how things are moving, there's more information, but it took a very long time to start
Yeah.
talking about hormones and to start talking about perimenopause, menopause, and, like the changes that are coming.
I hear from a lot of women that it's hard to find care from like a physician or a doctor when you're going through perimenopause, and a lot of doctors dismiss you or you feel like you're just getting nowhere. Why is that?
So this is very important, So before 2002, every woman that was going through menopause was getting hormone treatment, because we know that
Every woman was getting hormone
every
treatment
woman,
before 2002.
exactly,
Like hormone replacement
hormone
therapy?
replacement
Okay.
therapy, because we know there's been a lot of studies on, we know that hormones, they protect you from osteoporosis. So they protect your bone so you don't develop osteoporosis later on. It's very important to understand this. So estrogen, we have estrogen receptors anywhere in our body, from the tip of your hair
Okay.
to the tip of your toe. So we have
Estrogen
estrogen
receptors.
receptors. So that's how important estrogen is for our bodies,
Okay.
right? So when estrogen is dropping, then what's going to happen? All these different organs are going to work different, or we're going to feel different, And one of the biggest organ that is affected is the bone, because it doesn't have the estrogen.
Okay.
So then the bone gets weaker, and then women develop osteoporosis.
Yeah, we
That's
see
why
that in the studio. Like we've seen that with some of our older clients.
exactly, and that's why out of two people with osteoporosis, one is a woman.
Oh, okay.
So that's how bad it is, right?
Okay.
So, a lot of studies show how if you replace the, estrogen, and we're not really replacing it, we're just giving a little bit of that estrogen.
So during the perimenopause phase or
you can start
menopause
doing the
phase?
perimenopause phase
Okay.
depending on the symptoms, depending
Okay.
on the patient, but definitely menopause, postmenopause, estrogen is very important to be,
Okay.
replaced basically.
So you said after 2000, sorry, before, you said before 2002, everybody was commonly receiving
Yeah, estrogen and
hormone
progesterone.
treatment.
Exactly.
What happened after 2002?
So in 2002, there was this huge study that is called the Women's Health Initiative, and it was a very big study where big institutions, universities, wanted to see what was the effect of hormone treatment in all these postmenopausal women.
Okay.
So they included tons of women, millions of women, right, who were on hormones. So then they stopped the study ahead of time. They were thinking that it was going to be for so many years, and then they were like, no, we have to stop it, because apparently they saw that there was an increase in breast cancer in these
It was the
women.
time, I think it was the time in the world where breast cancer was very, there was a lot of
It was more
awareness around it. It was,
awareness,
yeah.
right. But
So
then
they were thinking hormone therapy
was causing
equals
breast cancer,
okay.
right?
Okay.
The reality was that it was a very small percentage of women that
Huh.
developed breast cancer.
Okay.
There were several things that were not noticed in that study. One was that most of the women were in their 60s, mid 60s. So
Okay.
that's not when we start hormone therapy. We usually start hormone therapy 50s
Okay.
or earlier. So that was that. So there were older women included in the study.
Okay.
Then the other thing was that
Like, yeah, postmenopause women. Yep.
exactly. So then the other thing is, so you're going to have higher risk, obviously, of
Of
cancer
breast
the
cancer
older
if
you
you're,
are,
yeah.
right? The other thing was that the hormones that were used were synthetic hormones. Synthetic meaning, that they were made in the lab, that they obviously were coming from pregnant horses. That's how those hormones were made, from the urine of pregnant horses.
Wait, that's how the synthetic hormones are made? From the urine of pregnant horses?
Yeah, pregnant mares.
I learn something new every day.
So
you heard it here first, guys.
so so that's the molecule obviously in the synthetic hormone is not the same as the molecule that we have in our bodies, right?
Makes sense.
So there's going to be a little bit more side effects from that too. And
Okay.
the main cause that the hormone that caused a little bit, and it was a small increase, it wasn't even that important. It was a progesterone.
Like scientifically,
it was a progestin,
okay.
the progestin, which is the synthetic form,
Okay.
of progesterone. So because of that, they said, everybody gets off the hormones. We can't continue prescribing them because there's going to be a big increase in, in breast cancer. When the reality is that it was a very small increase. It
Wow.
wasn't even significant, really. So then from there on, every woman was not able to get hormones again.
It was like illegal. It was banned.
It was
let's
just
say
not banned, but it was like,
frowned
well,
upon.
you're gonna be, like if you prescribe it and this patient develops breast cancer, it's gonna come against you.
Is
Right?
that why I hear from a lot of women in our studio that the concept of hormone replacement is still very taboo?
Totally.
Is
Totally.
that is this a reason for it? Is it
Yes.
because of
It's a big reason
this?
because, from this study, it was all over the news. It was everywhere.
And this was
And it
after
was-
2002. There was a
Yes.
study. Okay.
It was after that. It was all over the news. It was in every news, like TV show.
Yeah.
Everywhere. It was
At
like
the rise of breast
hormone
cancer, the rise
plus
of
breast
yeah.
cancer, right? So then all the women were like, I don't want breast cancer. So
Yeah.
everybody stopped their hormones. And then the doctors were like, I don't want to be sued.
Yeah.
Everybody stopped prescribing them. And the worst part is that they stopped teaching about hormones. There was
Wow.
no more education about like hormone therapy. Like I went to medical school, I went to residency, and I received I only got like one lecture of an hour about menopause.
Wow.
In all
One
that
lecture
training.
of 1 hour
Yeah.
from menopause?
Yeah, in all that training.
That's so interesting because I feel like that's what I hear from a lot of women, that they go to their doctors, they ask these questions and they can't get answers or any sort of proper care. And I actually heard from a study that there's actually not enough doctors in the US that are certified to support with menopause. So
Exactly.
we don't even have the resources yet that the women need.
No, not at all. So we're talking, 2002, right? So we're talking
Not that long
23
ago, yeah.
years. 23 years where education was non-existent, where a lot of women were not getting their hormones, and also there's no doctors who prescribe them, right? So there's a big problem because you're trying to explain to your doctor, but if your doctor is not prepared in menopause care,
Yeah.
he's not going to understand the symptoms that you're having. So a lot of the patients that we get to see are patients who already went to see a sleep doctor, already went to see a neurologist, already went to see the psychiatrist, already went to see a psychologist, already went to see a gastroenterologist. So they've been going through
And
all
those
these
doctors
specialists.
can't say like you're probably going through perimenopause or something. They can't.
No.
Who is certified or who is actually, let me ask this question. How do you find a doctor that does have knowledge in menopause? Like, how do you know if that person is even able to help you?
Yeah, so like in your case, for example, we are board certified in menopause. So there's a menopause
Oh, okay.
society, and the menopause you have to take a board exam so you can become a board certified menopause practitioner.
Okay, you
So-
guys, so if you are looking for a doctor to help through perimenopause, menopause, postmenopause, obviously reach out to LMD, but also you want to find someone board certified as a menopause provider. How do they find them?
So you can go to the website, the Menopause Society website,
Okay.
and then you can type in, where you live, zip code, and then it tells you the practitioners in the area.
That's amazing.
So
Okay.
then you can find one practitioner that is close to you or a practitioner that might be recommended,
Okay.
So then you have all the information right there. So just to give you an idea, I mean, certified menopause providers were less than 3,000
Where in the country?
in the country.
Oh my God, less than 3,000.
Yeah.
So there's no way every woman can access
Unfortunately not.
that kind of care.
Yeah, and there are physicians or providers that might be well studied in this topic, but they might not be certified, right? So they didn't take the board or things like that.
Okay.
So I think that it's very important also where you get your care from.
Yeah.
Just to make sure that the person that is providing the care is the person who knows
Yeah.
about what you're going through and treatment options and things like that.
Yeah.
But yeah, it's a big problem. And
That's a huge
and
problem.
especially because we know that population, there's going to be a lot of women who are going to be in perimenopause, menopause, and postmenopause very soon, and there's not going to be enough of us being
Yeah.
able to take care of all of them, right? So yeah, it's
So basically, doctors go into this field. There's a whole opening for the medical world to go into this type of care.
Right.
Yeah.
Because you would think that gynecologists know, but not.
That's what I would think. I'm so surprised they
Not
don't have like a
necessarily.
lot of
Yeah.
training in
No.
menopause, postmenopause.
I'm
care.
my